Well, thanks for this label. I don't know if I deserve it, but thanks anyway. It's an honor being known like this. And it may be because all of my years studying and dedicating all my studies in the upper limbs, the artistic sculpture, and also the anatomics. And I think the complexity working in arms is because of that. It's a part of the body where you can find lots of anatomical structures in such a small area, so it leaves you no room to error, and you have to be sharp technically, and also because the arms are exposed parts of the body, any error can be seen. So aesthetically you must be precise and also surgically. I have to agree, because as a woman there were many times that I wanted to go to a party and I not feel comfortable in my dress because of my arms. So I can know by myself, and this makes connections. I feel the discomfort one time, so I can understand their pain. This is empathic. So from a woman to another woman, I know that I have many colleagues, male colleagues, that are extremely talented, but in the end I can connect it in the inner part of their pain. Yes, to answer that question, I need to tell you a story about myself. In the past, I underwent a liposuction in my arms. I came from a family who doesn't like their arms. We have women with big arms, and before my wedding, I wanted to make my arms. So at this point, I analyzing, and I think as a patient that all the fat that I wanted to get removed from my arm didn't, because all the traditional techniques work in the arms in the inner part, and for me as a patient, I wanted to the top of my arms being removed. So after that, analyzing all the techniques, I thought that for a better result, I needed to work at 360, and that's I beginning to work like this. And since that day until now, I've been developing a technique that works in arms 360 to get more results. I used to say that I came to the lipedema world from the back door. I was always an aesthetic plastic surgeon, so my vision is the beauty, the shape of this. But in the lipedema patient, as I sculpt, I am also taking the disease off. So I give her not only a beautiful body that they deserve, but I am also make it functional. The difference between me and some other colleagues that I usually pay more attention in what I leave than what I took off, because the challenge is not only to work with the lipedema and take it off, but also to give those patients a beautiful arm that they deserve. So I can put it equally, not only the disease, but all the function, the beauty is important as the same. That's a really important question, because working in arms, as I said before, we have lots of noble structures in such a small area, and one of these important structures are the lymphatic system, and you need to work without leaving any damage. So you have to study and know the anatomy. You have to use a cannula, you have to go in the right direction not to damage. And I wanted to add that, because you asked about the stages. It's an error to think that the lipedema surgery is just for the patients who are in the end of the stages. The earlier stage, the better is the result. So to the doctors who work it, not surgically, with the patients, you have to talk about it with them, because to get the surgery in the beginning of the disease can be a game changer for this patient. Of course, she needs to still worry about the diet and all the other stuff that makes the conservative treatment important. But making the surgery in the early stage, she will have benefits, a lot of benefits.